Hello friends, in previous video I showed you that sleep report of that patient, one patient. For same patient we did titration study also. So in this lecture I'll discuss titration report of same patient, how to report and what are the parameters we should mention in our titration report also. So I have made video, this video in Hindi also, so you can see on my channel. So let's see titration report of same patient. So this is our patient, same patient whom I discussed report. We did titration report with CPAP. So regarding titration, for titration we can do by CPAP, manual CPAP. We can do by BiPAP in case of when that there is overlap syndrome or obesity patient, or when pressure requirement is high. In that case, we can use BiPAP. We can go for split night study. Means first half we do study. If there is severe OSA, then we in second half we can apply CPAP and see titration. Another method is by auto PAP or auto BiPAP. This is usually home-based titration. We give auto PAP to patient and asked him to come back after 15 days with report. So in auto PAP there is a memory card. After 15 days they download report and come to us, and we can identify what is the titration, how much pressure patient will be required. So but in our patient we did titration in lab in our hospital only, same patient. So how to do CPAP titration? So we have to start CPAP with 4 centimeter of water, and we have to increase one pressure every time. Okay, and we have to look for apnea, hypopnea, rera, and snoring. If there is more than 2 obstructive apnea, more than 3 hypopnea, more than 5 reras, or more than 3 minute of loud snoring, if it is any one of there, then we have to increase pressure by 1 centimeter. Again, we have to look these parameters. If anyone is there, again we have to increase. Okay, if pressure requirement is more than 15 centimeter of water, then we can switch over to BiPAP. It is little different in children less than 12 years. In them, we are seeing apnea 1, hypopnea 1, rera 3, and snoring for 1 minute. So there should be event-free period for more than 30 minutes, and there should be REM supine sleep at least for 15 minutes in that sleep report. Then only we can say that patient has adequate titration. Okay, so in our patient we did titration, and the parameters we looked before titration, like sleep architectures, efficiency, apnea, hypopnea, all these parameters we have to compare with CPAP and without CPAP. Then only you can explain to patient that whether CPAP is working or not, CPAP will work or not. We have to compare how much improvement is there with CPAP. So we will see again these all parameters with CPAP and without CPAP, and we will compare both. So this is our diagnostic part. Okay, first page. Here you can see this is diagnostic. Okay, diagnostic. Once we did titration, it is written as titration. Okay, again we have to check all height, weight, BMI, and we have to see that study was done for 8 hours, and 8 hours we did titration also, almost same time. Okay, so after titration, this is reported before titration. So before titration, sleep efficiency was 81.2%. Okay, after titration, sleep efficiency improved. Now it is 89.3%. Okay, so it should be more than 85. So after CPAP, patient is having very good sleep efficiency or normal sleep efficiency. Okay, now we have to see individual sleep stays. Surprisingly, patient has REM sleep of 15%, but after titration, after CPAP, it was having 69.1%. Okay, if you see deep sleep 26%, it is reduced to 3%. So this is sleep changes. This is sleep changes with titration. So in titration, patient sleep efficiency has increased and REM sleep has increased. So this is good sleep efficiency, I would rather say. Now before titration, patient was having AHI of how much? 32. Sorry, 46.4. Severe obstructive sleep apnea. RDI is 47.5. Okay. After titration or with CPAP, patient's AHI reduced 46 to 88, 8.8. Around 80% reduction in AHI. RDI same 9.1. So there is marked improvement in AHI or RDI. Okay. So this is good titration. We can see these parameters also like maximum hypopnea, maximum apnea. This also reduced. It was 61. Now this is 30. This was 98. This was 40. So every parameters related to respiratory analysis is improved with our titration or CPAP. If we see oxygen, there is there is improvement in apnea, hypopnea. Obviously, airflow will get improved, so oxygen should also improve. So before CPAP, the patient having desaturation index was 73 without CPAP. But with CPAP, it is just 4.5, around 90% reduction in desaturation index, means oxygen is improved a lot. Previously, it was going up to 67, now it is 88%. Mark improved. Below 90%, it was around 2 hours. Now this is almost 0, 5 seconds. 0. It was 31.9. So you can observe that with CPAP, there is marked improvement in oxygen. If patient will get good oxygen, the chances of complication will be reduced, like chance of CAD, chance of stroke, chance of cor pulmonale, chance of pulmonary arterial hypertension, they will all reduce once he will apply CPAP. You can see marked improvement in oxygen index. Now heart rate. Heart rate, if patient is having prolonged hypoxia, there will be problem in heart in terms of arrhythmia. Okay. So heart rate, heart parameters, they will not improve very easily. It will take long time. Okay. So in this patient, without CPAP, it was 11.2 arrhythmia index, but now it is 8.3. So there's a little reduction. As I told you, this is chronic process. It will take time. Maximum heart rate, minimum heart rate is almost same. Okay, so this is mild improvement in heart rate. What about snoring? Before titration, it was 422 index and 37.9% of sleep he was having episodic snoring. Now from 422, it is now reduced to 55, almost 80% reduction in snoring. You can imagine how comfortably bed partner is sleeping with him. You can imagine. Okay. Episodic, it is come to 3.6. Again, around 90% reduction in episodic snoring also. So this is very wonderful effect by CPAP. Once he apply will once he will apply CPAP, here apnea gone, hypopnea gone, oxygen improvement, and there is very much improvement snore also. Very comfortable sleep. Okay. What about arousal? Because arousals causing daytime somnolence or daytime sleepiness. In this patient, because of respiratory, because of desaturation, because snoring, this much having arousals. Now with CPAP, he respiratory is reduced to 2, desaturation 12.4, and snore is 1.3. Marked reduction in arousal. Patient is sleeping very comfortably. Patient not getting up at night. Once he will get sound sleep at night, patient will be very comfortable at daytime. Is very alert. There's no daytime sleepiness. Once there will be reduction in arousals. So marked improvement in this patient. Now coming to pulse transit time. So before titration, pulse transit time was 37.8. now 27.9. Now you must be wondering that there is no significant reduction in PTT. But mind you, you compare this part with CPAP. So you can see before titration, patient was having PTT because of respiratory is 14.5, because snore 12.9. Now you can see 1.4 and snore 5.5. So you can see this graph also. See larger part by blue and green. Now very less by blue and green also reduced. So most of the PTT in this patient is spontaneous. We are not bothering about spontaneous PTT. Okay. So there is reduction in PTT as respiratory PTT, snore PTT has been reduced. There is marked improvement. Now blood pressure. So there is reduction in blood pressure also. Okay. So again, if you see increase index 31.4 and in the 37.2, there is I would say rather increase, but it is not increase actually. Why? Because of respiratory. See, this is respiratory 12.1. Now respiratory is just 2. Because of snore, it was 9.9. It is 5.9. Okay. So you can compare this graph. So blood pressure increment index is increased, but not because of respiratory and snore. It is reduced in terms of respiratory and snore. You can compare blue part is reduced significantly. Snore also reduced. Increase in spontaneously. And we are not bothered about spontaneous increase in BP. We are concerned about sleep part. Okay. So there is marked reduction in blood pressure parameters also. Now, static pressure, we can see systolic, diastolic, MAP. So there is almost same because it will take months and years to get improvement in BP. Once patient will apply CPAP for long time, then only you can see significant effect. Okay. So after titration, after comparing all parameters, we have to see whether our titration was optimal, good or adequate. When to say optimal? When RDI is reduced less than 15 events per hour for at least 15 minutes. Okay. But mind you, patients should have supine and REM sleep. Okay. It should not be interrupted by arousal or awakening. Then only we can see optimal. What is good? If AHI is reduced less than 10 events per hour, or there is reduction in 50% if RDI is less than 15, then we can say it is good. But again, patient should have uninterrupted supine and REM sleep. Then only we can say good. Adequate, if RDI is not reduced to less than 10, but reduction in 75% along with supine and REM, then it's adequate. If above criteria is met, means RDI is less than 5 and there is no supine or REM sleep, or supine REM sleep interruption is there, then it is adequate. So we have to classify our titration in these three terms: optimal, good or adequate. So you have to remember this definition. So this is again eyeballing. So red become yellow and green. So this is, by seeing this chart, we can see that you have improvement by CPAP titration. So this is final report what we are giving to patients. So we are giving patient this report: mean CPAP pressure, recommended CPAP pressure, how much pressure patient should apply in his CPAP. Okay. So we are comparing all data and we are explaining patient also. Before CPAP, you were having sleep efficiency, AHI, this thing. After CPAP, you have this thing. These are important parameters we should remember: sleep efficiency, AHI, ODI, arrhythmia, snore, blood pressure, maximum HR, and again, and last one is this arousal index. We have to compare. After titration, we have to mark whether titration was optimal, good, or adequate. Then final impression. Final impression, that patient was having good titration, and with CPAP, his sleep apnea become from severe to mild or severe to normal. And at last, we have to advise sleep hygiene, weight reduction, and CPAP, auto CPAP or manual CPAP, whatever patient is comfortable with. Okay, so this is how we are giving report, and we have to review patient after 2 weeks with downloaded data from CPAP. So we can see compliance, because compliance is very challenging. So we have to monitor compliance every 2 weeks initially. So this is how we are giving final report of titration. I hope this video is useful for you. So if you like it, please share with your friends. And if you want to see more videos on sleep medicine, just scan this QR code. And my previous videos are also in Hindi, so you can watch and learn from it. See you with next video. Thank you very much.